I can tell you that for the vast majority of patients, any of those procedures will be fine in principle. In fact, when patients tell me what is the worst procedure I can have, I tell them the worst option would be to do nothing. And let obesity run wild, obviously. So any of those interventions are fine. But clearly, some interventions are much better applicable to an individual than others. In general, it is no surprise that the vast majority of patients nowadays in the United States or even in the world choose to have the gastric sleeve or the sleeve gastrectomy. And the sleeve gastrectomy is appealing and applicable to the vast majority of patients because of its intuitive simplicity, right? The stomach is big, the stomach is distensible. Let's make it smaller so we can eat less food, we have less hunger, but also there are other metabolic benefits of the procedure. And it is a procedure that has a proven track record, not only in its results, but also in its safety. We talk about how the gastric sleeve, Kamal, now is as safe as very commonly undertaken surgical procedures like the gallbladder surgery or hysterectomy or even appendectomy to some extent. So the vast majority of patients who are looking for a robust weight loss, we're talking about patients wanting to lose 60 pounds, 80 pounds, 100 pounds, 150 pounds, the gastric sleeve will do with that safety track, but also with the fact that the gastric sleeve does not require rerouting of the intestine. Rerouting of the intestine, which is a process that is done when we do the gastric bypass, introduces issues and problems for the future that the gastric sleeve doesn't have.